In vitro fertilization in Russia from this year will become for free. IVF will be covered from the mandatory medical insurance. It will be enough to have a policy. Earlier, this procedure could be done only under the quotas of the Ministry of Health. More details are going to be discussed with the Deputy Director of the Center of Obstetrics and Gynecology and Perinatology, academician Leila Adamyan. Leila Vladimirovna, good day. Thank you for coming. The topic is very important, and in the beginning, let us speak about this program. Is it going to work from year 2013, and everybody who's got an insurance policy of mandatory medical insurance can pass this procedure of IVF at the expense of the government? No, of course not at once and not for everybody. IVF is fertilization which is conducted outside the body of a woman. An oocyte is fertilized with a spermatozoid, and the fertilized oocyte is transferred to the body of a woman. Until today, IVF was for a payment in many centers of Russia, mostly, and it was conducted for free for a patient, but under the governmental quotas, the government paid for some quotas for especially complicated cases. And the new thing in this sphere is that in vitro fertilization will be covered from the budget. In some limits, of course. Yes, of course, even in the most rich. Let us tell me some figures. Well, I cannot tell you any figures, but we can tell you that in principle, if a patient is covered with insurance and she has got an insurance company or mandatory medical insurance, then this insurance company is going to cover this issue completely. Of course, it's not going to be at once. We are only setting out on this complicated path. The only negative point in this respect is that the main patients are going to be women who have tuboperitoneal infertility. So it means not everybody can count on participating in this program. Yes, but in any case, this is of great assistance because most women who need IVF are women who have tuboperitoneal infertility. That is to say, their uterine tubes are either absent or they are blocked, so they cannot get pregnant. In this program, the male infertility factor is not taken into account, unfortunately, and many other factors are not taken into account. But the complicated patients who require IVF are going to participate in the high-tech medical care. This is an expensive medical high-tech care. Now, let us specify more financial issues, because IVF is very expensive. In private clinics, it can cost 200 or 250,000 rubles. And I read that the government is going to fund up to 106,000 rubles, and the difference will have to be paid by those who participate in the program. You know, in high-tech medical care, in highly effective medical care, it costs 124,000 rubles. So the government is going to pay 106,000 rubles. So this is a huge sum, huge amount. It's a half. No, it's not a half, it's a 3/4. And it's great because the main things are going to be covered by the government. And in our country, high-tech medical care is much cheaper than in other countries, and the price is based not on the procedure of IVF mostly, but on many other methods of screening that are required for a woman or a complicated patient. Now, the number of free attempts, IVF attempts, in vitro fertilization, is it limited in this program? Because when we speak about quotas, which used to be in the past, there was only one free attempt, and experts say that it was very seldom that people succeeded, and later they had to pay for the IVF themselves. It's not yet clear how it's going to work. The year 2013 has just started, and for our country this is a huge step forward, and I have to say that in principle in the past few years our country has made colossal breakthrough in this respect. Earlier we could not even dream about that. I have been working working for 40 years in medicine, and I can say exactly that that attention which is being paid to women of reproductive age, to infertility, we did not have that in the past. Today, the infertility treatment is in the legislation, and new methods of treatment, new methods of diagnostics of different problems in the development of fetus, pre-implantation diagnostics, all of these are included, are specified in the legislation, and new regulations take into account some issues which were not taken into account before. Before the last year, for example, IVF could be afforded by a woman who only by a woman who is married, and she could not have a child in any other way, even adopted. Even those who did not have children at all could not do it. No. And now, a woman who is not guilty of not having a child, maybe she does not have a husband, or maybe some tragedy happened to the husband, or maybe he does not want to have a child. This issue in our country, thanks to the new legislation, has been resolved. Any patient, any woman who would like to have a child, she can, irrespective of whether she is married or not, upon her agreement, and even she can apply for surrogacy, and later she can adopt her child. Well, of course, this is great progress. Yes, it is a great progress. And in conclusion, the patient, will they be able to choose the clinic, private or governmental? Of course, this is another piece of good news for our country, that today the patient can follow his doctor. There is no difference for a patient who pays for her. The government or she pays for the treatment. It is important for her to receive good treatment, and this way doctors and clinics are going to be ranked. So this is going to create some new competition in the market. Yes, this will create additional competition or motivation, whatever you call it. But in any case, this is great progress. And also in IVF, there are a lot of new things. Now we have clinics in our country who provide pre-implantation diagnostics of the diseases in the fetus. Today, 5 diseases are diagnosed, such as Down disease, etc. But I think that in the future, IVF will be possible for patients with oncological diseases, so this is not a limit yet. Currently, we live in an age when a real progress is not only heard. We hear it on the radio or see it on the television every day, where our top governmental officials have learned these difficult words such as in vitro fertilization, pre-implantation diagnostics, prenatal diagnostics, fetus as a patient. This is fantastic, to be honest. Leila Vladimir, and I have one more question. I know that there are a lot of discussions on the forums. Those couples who have applied for quotas under the old regulations, what will happen to them? Can they change that? Because, of course, there are new opportunities under the new law. Why do you ask that? Because they had only one attempt. No. This is a small misunderstanding. It's not yet clear how many attempts will be provided. Quotas are given for complicated patients, a patient who have infertility, but they have some associated or complications such as tumors or endometriosis, and she requires more efforts and more money. So there is no need for people who asked for a quota and they are indicated to have, they have an indication for an IVF, they will be able to have a child. So the most important thing is that they have good health for that and good age for that. It's not good to apply for IVF only when a person has resolved all their tasks, like they received education, they found a job, divorced a couple of times, did 5 abortions, and after that they cannot have a child. This is not a right policy. And now on television I would like to say that we should not create problems until we need to have IVF. It's better to have prophylactic, not to do abortions, and to have children in due time. And then the children are going to be healthy, and the family will have a possibility of not only growing a good child, but also to bring up a child with happiness, not only when a person has, lots of diseases and only after that applies for IVF. I couldn't agree more, but I have just a few more questions. When will this program start to work? It has already started working, but we need to see how it is going to be implemented in our life, how it's going to replace the paid IVF and IVF under quotas, because quotas and paid high-tech medical care is going to cease in 2015. But whatever is done in this respect is very progressive. I think that we're at the threshold of colossal changes. Well, you have anticipated my question. On Monday, we're going to have an international Congress on reproductive medicine. What are you going to discuss? Maybe some innovations? I can be proud that for 20 or more years we have conducted these huge forums. They are huge not only in terms of the number of people who come, but also in terms of the level of participants. World's stars participate in our congresses. We had different congresses, also endoscopic surgery congress. I'm a surgeon of endoscopic surgery, and this surgery allows for a woman to become pregnant without any IVF, so you can apply to me for the help. I will be happy to help. And this Congress is going to gather together reproductologists from all of the world, such as France, Germany, Belgium, Israel, etc. So there is no some key figure or key country who is going to arrive at our Congress. So they are all respectful towards our center and our country, and this is a sign of some serious respect towards us, and it means that we are of high authority in this sphere. Besides, there will be a demonstration of new technologies in surgery, endoscopic surgery through small punctures instead of cuts that I'm promoting for many years, and lots of new things are going to be shown in the sphere of fetus as a patient. We do not like surprises. We like when a patient becomes pregnant, she bears a child in the age, in a normal age, not after 35, but before 38. This is normal, this is correct. And we can see the birth of a child with all possible problems. So we can receive that child with all the problems and provide timely help if it is needed. Thanks a lot for your comment, and I wish you success in your very important job. Thanks a lot. I will remind you that we had the chief gynecologist of Russia.